Welcome to The Explainer. Today, we're diving into a massive, millennium-old medical secret. It's something that completely blew my mind when I first learned about it. We usually think of our modern operating rooms as, relatively recent inventions. We assume they rely entirely on modern laboratories and technological leaps from the last century. But what if the very foundation of the modern operating room was actually poured over 1,000 years ago, during the golden age of Islamic Spain? We're about to meet a historical genius whose name might be totally new to you, but whose vital contributions you, or someone you know, have almost certainly benefited from.
Okay, let's dive into this. When you picture a modern operating room, you think of the bright lights, the perfectly sterile environment, and those incredibly precise metal scalpels, retractors, and forceps, right? So where do those tools actually come from? We'd normally guess they were invented by European doctors, maybe back in the 1800s, but the true origins are honestly far more fascinating. To find the blueprint for these life-saving instruments, we have to travel all the way back in time to the 10th century, to a world where a lone innovator was quietly revolutionizing the way human beings heal. So meet the man behind the marvels, Abu al-Qasim Khalaf ibn al-Abbas al-Zahrawi. In the West, he's also widely known by his Latinized name, Al-Bukhasis. He was born back in 936 CE in Madinat al-Zahara, which is just outside the great city of Córdoba in Islamic Spain, and he descended from the Ansar tribe of Arabia. Al-Zahrawi wasn't just your average physician. He was a brilliant chemist and an absolutely unparalleled surgeon. In fact, if you look at the historical record, he's widely considered the greatest surgeon of the Middle Ages. Today, he is literally celebrated as the father of modern surgery.
Section 1. The Masterpiece, Al-Tashrif. This masterpiece was the absolute culmination of his life's work, finalized around 1000 CE after nearly 50 years of relentless daily medical practice.
And that brings us to this incredible number, 30. You see, Al-Zahrawi didn't just write a quick pamphlet or a pocket guide. His comprehensive medical encyclopedia, officially titled Kitab al-Tashrif, was composed of 30 distinct, massive treatises. It was a wildly ambitious project, designed from the ground up to cover absolutely everything a practicing physician would need to know to heal their patients.
Just to put the sheer scale of this into perspective, the encyclopedia spanned a staggering 1,500 pages. Imagine writing all of that out by hand, without a backspace key or spell check. It basically served as the ultimate ready reference guide of its time, answering practically all kinds of clinical problems. Whether you are a medical student just learning the ropes, or a seasoned physician facing a truly baffling case, this 1,500-page encyclopedia was the most vital companion you could possibly have.
There's a quote from him that I absolutely love. He wrote, "Whatever I know, I owe solely to my assiduous reading of books of the ancients, to my desire to understand them and to appropriate this science. Then I have added the observation and experience of my whole life." This is just such a powerful quote because it really humanizes him. It shows us that he had a deep, profound respect for the classical teachings of the Greco-Roman world. But the thing is, he didn't stop there. He didn't just blindly copy the ancients. He relentlessly tested their theories against his own unparalleled, hands-on empirical observation.
Section 2. Revolutionary Medical Discoveries. Let's shift our focus to the specific, groundbreaking medical firsts that are actually hidden within his massive encyclopedia.
Right off the bat, the very first two treatises were incredibly foundational. In them, Al-Zahrawi meticulously classified 325 different diseases. And he didn't just list them out, he deeply discussed their symptomatology and their exact treatments. These two volumes were so vital to medicine that centuries later, they were translated into Latin under the title Liber Theoricae, eventually making their way to the Augsburg presses in 1519 to help educate European doctors. Actually, if you look at folio 145 of that Latin translation, you'll find something astounding. Al-Zahrawi became the literal first person in the entire history of medicine to describe a hemorrhagic disease that is transmitted by unaffected women to their male children. Today, of course, we know this hereditary condition as hemophilia, but he diagnosed and documented its hereditary nature a full millennium ago.
But he definitely didn't stop at blood disorders. His expertise was incredibly broad. We're talking dentistry, bone setting, cauterization techniques, wound treatment, and even highly specialized fields like ophthalmology and military medicine. One of his absolute most astonishing achievements, though, was his work in obstetrics. Al-Zahrawi was the first to accurately describe an abdominal pregnancy, which is a subtype of ectopic pregnancy. Before his precise medical interventions, this was a practically universally fatal affliction for the mother. He was actively saving lives by pushing the boundaries of what anyone thought was medically possible.
Section 3.
The 30th treatise, The First Surgical Instruments. Now, what's really interesting about this slide is how it transitions us to the absolute most famous part of Al-Zahrawi, the 30th volume, which is dedicated entirely to surgery.
In this final, legendary 30th volume, Al-Zahrawi provided the earliest pictures of surgical instruments in all of human history. He didn't just do a couple of quick sketches. He meticulously illustrated and described approximately 200 different tools. He explained exactly how each and every instrument was to be used in actual surgical procedures. And guess what? Many of these 200 instruments are the direct ancestors to the equipment your own surgeon or dentist uses on you today.
He also meticulously organized this massive 300-page surgery treatise. He categorized it into 56 sections on cauterization, 97 on general surgery, and 35 sections entirely dedicated to orthopedics. This proves it was the first independent book of its sheer size devoted completely to the craft of surgery. It was systematic, highly organized, and meant to be a practical, everyday life-saving manual. Section 4. A 500-year medical legacy. Let's move to and see how this builds, because this Andalusian text completely conquered European medical universities.
Check out this timeline. After it was completed around 1000 CE, Al-Zahrawi didn't just sit collecting dust on a shelf. By the late 12th century, Gerard of Cremona translated the surgical volume into Latin. By 1460, it was adapted in Anatolia by Şerefeddin Sabungioglu. It was printed in at least 10 different Latin editions across Europe, and was even published as an Oxford edition as late as 1778 by John Channing. For over half a millennium, this text was the absolute gold standard for surgery in Western Christendom and beyond.
Because of this massive dissemination, almost all European authors of surgical texts from the 12th all the way to the 16th centuries copied directly from him. Famous medieval European surgeons, guys like Roger of Salerno and Guy de Chauliac, heavily referenced his techniques. The influence stretched all the way into the 18th century. The renowned Scottish physician William Hunter actually had an Arabic manuscript of Al-Zahrawi's work brought all the way from Aleppo in Syria specifically to aid his own study on aneurysms. That is a 700-year chain of medical knowledge crossing continents and cultures. It's just wild.
Which leaves us with a final thought today. If the detailed blueprints of state-of-the-art hospitals today trace back to a 10th century physician in Islamic Spain, how many other modern marvels are hiding in ancient manuscripts, just waiting to be uncovered? It really challenges us to rethink the origins of modern science and remember the unsung historical heroes who paved the way for the knowledge we completely take for granted today. Thanks for joining me on this explainer. Keep questioning, keep learning, and I'll catch you on the next one.